at 6.
It is a modern healthcare billing nightmare. You're told your surgery will cost you $2,000 out of pocket, but then the bill comes and you're on the hook for much more. In this case, about $40,000 more. We wanted to learn how it could happen and how to keep it from happening to you in our 15 Finds Out special report, Max Out of Pocket.
The medical care was outstanding. It was just the surprise with the insurance situation is what caught us.
After emailing and texting with Dwight Taylor, we finally met at his fixer-up retirement house. Dwight retired a couple of years ago at the age of 60 and put some money aside for health care to cover the 5-year gap until he was eligible for Medicare. Since he and his wife were in good health, they chose an insurance plan that only covered major medical expenses. But that insurance plan paid for things like routine checkups and blood work.
It was just smooth sailing.
Since he'd already spent a lot of out-of-pocket, he scheduled his non-emergency hernia surgery for December 2021.
I just assumed, bad assumption obviously on my part, presenting the insurance, not hearing anything back, that it was going to go through, and just proceeded to get the care.
No, that's not dumb.
That's health insurance expert Michelle Walters with Health Insurance Shop. More with her in a minute. Dwight gives his insurance information to the medical provider, in this case Parkview Health, and is told his max out-of-pocket will be $2,039.
Had the procedure. The support was great. The recovery was easy. Well, easy, but as expected. And I was able to, early in 2022, start to resume my activities and thought nothing more of it.
Until
I, in the mail, get a invoice from Parkview, and that's when we were informed that well, your medical provider didn't tell you. Tell me what? Well, that procedure's not covered. So a little bit of a shock.
You laugh. I don't think you were laughing when you saw that.
No.
The bill was for how much?
The initial was $41,000. At the bottom, there was kind of a disclaimer paragraph that said you can set up 48 monthly payments of $1,000, and just like, it's no big deal. This wasn't, Billy Bob's insurance company that I know better than that, right? It's actually United Healthcare, and big name, big insurance company, which also led me maybe to be a little bit more complacent than I should have been, figuring that United Healthcare, pretty good company. So I felt comfortable with the level that we got.
Yet he still got burned.
Well, and I'm presuming that what he had was probably one of these short-term major medical contracts.
Exactly right. Health insurance is now divided into two groups. Marketplace plans, like the expensive ones you're used to as an employee, and the non-marketplace plans that can have all sorts of exclusions for things like, well, in Dwight's case, scuba diving, or non-emergency hernia surgery.
The cards all look very similar. So they are then relying on whomever they are calling for that prior authorization to be able to state, no, this particular plan doesn't cover that type of procedure.
In August, we asked Parkview what happened. They sent us a statement that said, in part, while the insurance company confirmed that no prior authorization was needed, they did not share that Mr. Taylor had a limited benefit policy that would not cover the procedure at any facility. Parkview suggested he apply for financial assistance.
I was very uncomfortable. I understand it. I understand the reason for all of that. But it was pretty extensive. It was bank accounts, a couple of months worth of statements. It was pretty intrusive.
How binding are those estimates? David Farnbaugh is a partner at Sweeney Law.
Your question is, can they try to, backtrack and say, well, this was just an estimate or whatever? I believe it's sort of legally binding when they tell you, here is what your patient out-of-pocket is going to be because we've been told by your health insurance plan they're going to pay X. We've actually checked and have actually obtained pre-authorization. In this case, I think the nub of the problem is they never really obtained pre-authorization from the insurance carrier.
He strongly recommends doing something almost none of us do. Read your policy from start to finish.
The information's not all that complex. I wouldn't say to the penny, but you can get pretty close to figuring out what your responsibility is for a certain type of medical procedure.
But we like to click on the terms of service, accept right away. Right. Nobody reads that, nobody prints that, just lawyers do that.
Yeah.
For peace of mind, as a consumer, I would say by all means, call that prior authorization number and just make sure that the provider has called. That way you don't go in that morning of that surgery and you've been fasting all night and you're ready to go under, and all of a sudden they say, well, no, we can't do it. Your insurance company's denied it. I've had that happen several times.
As for Dwight, nearly a year after his surgery, he finally got an answer.
They called me on the phone and said, we've arrived at a decision. So I'm like, okay, what is it? Loaded for bear. But they said, we've decided to not forgive, but to dismiss the amount that you owe, and they used the term and attributed it to Parkview error. So I thank them very much, and that was it.
Did you ask for that in writing?
I did not.
Yeah, Dwight said he didn't really want to push his luck there by asking for it in writing, but we did ask for it in writing, and we were told yes, his case was closed. Parkview mentioned no mention of error, but added to help Mr. Taylor avoid future concerns with his limited benefit policy, we were able to connect him with a third-party resource that could explain his options, including an insurance plan with expanded coverage. To see their full statement and what United Healthcare told us, head to Wayne.com.
Now, your